Hi, my name is Dan Leger. I'm an orthopedic surgeon at Excela Health. I specialize in non-operative and operative treatment of the knee and shoulder. The rotator cuff is a group of 4 muscles that surround and support the shoulder and helps the shoulder do movements like forward elevation and rotation. And since the shoulder is such a mobile joint, the rotator cuff is used extensively, and that makes it prone to injury. So rotator cuff injuries can be an overuse type syndrome like a tendonitis, or they can actually involve tears of the tendon. Rotator cuff tears can be partial thickness tears that commonly occur from progressive wear and tear that adds up over time, or they can be full thickness, such as a trauma like a fall. Symptoms of a rotator cuff injury commonly include decreased motion and decreased strength in the affected shoulder. So patients commonly say that they have issues doing activity at or above eye level. So things like washing their hair or putting an item away on a high shelf can become difficult for patients. Another common complaint is that they have pain in the shoulder that gets worse at night, and that makes it difficult to sleep. Those at higher risk for a rotator cuff injury are people that do repetitive overhead activity. So people that work as a painter or an electrician, or people that like to play golf or tennis on a regular basis. They're at a little bit higher risk. But patients can get a rotator cuff injury from a trauma like a fall. They can get it from trying to lift or push an item that's too heavy, or even something simple like reaching into the backseat of their car. So the diagnosis of a rotator cuff injury starts by just sitting down and talking to the patient and letting them tell you about their shoulder pain. So I commonly ask questions like, how long's it been there? Was there an injury, or did it just start gradually over time? And what treatments, if any, have been tried so far? Next, there's a physical exam, so that involves checking the movement and the strength of the shoulder. And there's several specific tests that I can do that can point towards a rotator cuff injury. We commonly get x-rays in the office to rule out a bony cause of the pain like arthritis or even a fracture if there was a fall. And if suspicion is high enough that there's a rotator cuff injury, we sometimes send patients for an MRI. That gives a much better look at the rotator cuff better than an x-ray can. Some rotator cuff injuries can be left untreated for a period of time, and some really shouldn't. Full thickness tears in the rotator cuff have a tendency to get worse over time. The tear gets larger, and the tear has a tendency to retract away from its normal attachment site, and that makes it harder to repair. So those type of rotator cuff injuries should be addressed sooner than later. Other injuries like tendonitis or a partial thickness tear can be treated for a period of time without long-term consequences. Treatments for rotator cuff injuries start basic. They start with just avoiding activity that bothers the shoulder. They can include oral medications like anti-inflammatories and an exercise or physical therapy program. If those don't work, then we commonly try an injection of cortisone to help decrease the pain and inflammation around the shoulder. If those treatments have been unsuccessful and the patient has significant damage to their shoulder that's affecting their quality of life, then a rotator cuff repair may be appropriate for that patient.